HMA failure MDS actually represents a patient group with really no standard of care options and pretty poor outcomes. I would actually argue in hematologic malignancies, it's a patient group that has really the greatest unmet need, again, with a median survival of less than 6 months in high risk and less than 18 months in low risk, and really no targetable options. So SX-682 is a very potent small molecule inhibitor of the CXCR2 chemokine receptor that sort of plays a dual role in myelodysplastic syndrome. One is important in myeloid-derived suppressor cells, which are an adverse immune cell population, while at the same time playing a role in sort of the leukemic stem cell survival. So the goal is to sort of dually eliminate the leukemic stem cells while at the same time eradicate these adverse immune cells. So we present the completed phase 1 dose escalation trial. We actually dose escalated up through 400 milligrams twice a day and actually chose 200 milligrams twice a day as our biologically effective dose. Quite safe. It does show transient neutropenia, which is actually an on-target effect. This has to do with neutrophil trafficking, but importantly did not have any infectious related complications and no dose-limiting toxicities. When we look at efficacy, actually starting at the 50 milligram dose, we actually started to have responses. And if we look at the 200 milligram twice daily dose, half of our patients, again in an HMA failure setting, had response, including multiple patients that had significant improvements of blood counts. One patient, just to highlight, is a patient that was actually on drug for almost 18 months who had a transfusion-free period for over 4 months and was heavily transfusion dependent in the past. So as far as future directions of the program, we are now undergoing an expansion in this exact patient population of HMA failure, but simultaneously we'll have another expansion in patients that are HMA naive that may even be more sensitive to this therapy. So we're optimistic about the future and continue to enroll on this trial.